Hello and welcome all to the PaediaShorts Podcast, brought to you by MedSynapse. PaediaShorts Podcast series covers a wide range of clinical and scientific medical content that offers enriching insights into the world of pediatrics. Listen to our today's podcast episode, which focuses on the management of COVID-19 in children after admission to hospital. This episode gives a brief summary of the recommendations produced by the British Paediatric Respiratory Society and the British Paediatric Allergy, Immunity, and Infection Group that was last modified in February 2021. After a child has tested positive for severe acute respiratory syndrome coronavirus 2, or COVID-19, the first thing recommended for good clinical care in children is involving parents. Communication with the families about the treatment course and health status is very important. The decision to admit a child with COVID-19 should be based on a child's clinical presentation, requirement for supportive care, underlying medical conditions, and the ability for caregivers to care for the child at home. Once the admission is done, it is recommended to follow normal antibiotic prescription. The pediatric team should ensure that they have sought a focus of infection through various tests as appropriate prior to starting antibiotics. For children with comorbidities, such as cystic fibrosis, antibiotic choice should be based on known bacterial colonization. Antibiotic choice, duration, route of administration should be reviewed daily in the context of clinical progression and pathology results. It is recommended to discuss the treatment criteria for COVID-19 specific therapy with a pediatric infectious disease specialist prior to initializing treatment. Corticosteroids such as dexamethasone should be considered for use in children older than 5 years with severe or critical COVID-19. Dosing of dexamethasone should be 150 micrograms per kilogram intravenous or maximum 6 milligrams orally, once daily for 10 days. Corticosteroids consideration in children aged between 44 weeks gestation and 5 years should be discussed on a case-to-case basis. For children requiring supplemental oxygen, remdesivir should be considered for those older than 12 years and with greater than 40 kilograms. Dosing should be as per SMPC. Investigational therapies are recommended for all patients. Wherever possible, all patients should only receive these therapies within a treatment trial. These therapies include azithromycin, convalescent plasma, tocilizumab, synthetic neutralizing antibodies, and anakinra. Paracetamol is recommended as the first line of antipyretic. It is recommended to monitor fluid balance as well as measure daily weight in children who have fluid intake concerns. In case of COVID-19 related coagulopathy, pulmonary embolism should only be considered if sudden worsening of hypoxemia, blood pressure or tachycardia occurs, or if oxygen requirements are disproportionate to the severity of pneumonia on chest X-ray or CXR. In case of any clinical signs suggestive of deep vein thrombosis, confirmation should be sought after performing a compression ultrasonography. A local hematology team should be consulted for children with severe infection, abnormal coagulation results, or even pediatric inflammatory multisystem syndrome temporarily associated with COVID-19. Only after consultation, prophylactic low molecular weight heparin should be considered in these patients. In children with asthma attacks, it is recommended not to use bronchodilators routinely unless a strong suspicion of bronchoconstriction. Salbutamol and systemic steroids is recommended as a prompt treatment strategy in children with acute wheeze or asthma attacks. However, there is insufficient evidence whether to recommend ipratropium bromide if salbutamol is given through a metered dose inhaler or MDI. This is considered as effective as nebulization. Most children with COVID-19 are less likely to develop respiratory failure. It is recommended to initiate a low-flow nasal cannula oxygen, or LFNC, if they are hypoxic. Decision to use a high-flow nasal cannula, or HFNC, should be taken by a senior team member. Currently, there is no specific guidance for discharge. However, it is recommended that the parents should seek medical advice if the child has persistent symptoms, even after discharge. Research studies are still underway for proper establishment of structured advice for management of COVID-19 in children. This concludes our today's PaediaShorts podcast, brought to you by MedSynapse. Thank you for listening.